Good morning, everybody. Welcome to your April 2022 Integrated Eligibility Webinar, which is now called the Oregon Eligibility Learning Series. We are happy to have you today, and today's topic is getting ready for the end of the federal COVID-19 public health emergency. Some of us refer to that as redeterminations, and we are going to walk you through what we know right now and what you and your clients can do right now. And we have some folks here to also answer some of your questions and to ask you some questions. So hang in there. And we have an hour and 15 minutes today. We'll see if we take up the whole time. The first thing I want to say is that this used to be called the IE webinar. It's now the Oregon Eligibility Learning Series. And there you have it. We bring this to you every month by getting together with our community partner outreach program staff, our eligibility and processing teams, our policy teams, and other subject matter experts. And several of them are here today to answer questions. So let's do a quick round of introductions. Christy Taylor from Policy, can you say hello?
Hello, everyone. I'm Christy Taylor. I am a eligibility policy person with Medicaid programs and work on one system design.
Thank you. And I believe we may have, we have Tammy Rust here from Communications.
Hi, good morning, everyone. Tammy Rust with OHA Communications and working on the redeterminations project.
Excellent. Thank you for being here. Let's see, we have Jessica from our team who's been working on redeterminations as well.
Hello, everyone. This is Jessica Diaz, your provider outreach and engagement strategist on the CPOP team.
Great. And then I have just invited somebody to be here and be one of our organizers. And let's see if Colin can hear us yet. Colin, can you introduce yourself? Sorry to put you on the spot like that.
No problem. Hey, this is Colin. I can hear you just fine. WebEx says that I'm unmuted, so hopefully you can hear me. I'm with the Oregon Health Authority Ombuds Program. I'm our ombuds on point for anything redeterminations related. I'm also working on the COVID feedback team, and this is sort of the perfect storm of both COVID and redeterminations. So I'll be helping out from that side of things.
Thank you for being here, Colin. All right. A couple terms just to make sure that you know what they are, and so we can make our slides shorter. So the PHE refers to the
Started recording?
We are recording, yes.
Okay, just checking. Thank you.
Thank you very much. The PHE refers to the COVID-19 federal public health emergency. And if we had to write that every time on the slides, they would get even more wordy. So we're just going to refer to it as the PHE, but that is the federal public health emergency. The other term that you've probably all heard by now is redetermination. And that's the process by which ODHS reviews eligibility to determine if somebody is eligible for ongoing medical benefits. And it's basically like a renewal, but it is this big period of redeterminations after a time when we were not closing and ending benefits. But it really functions like a renewal, so I think it will look very familiar to you in that way. CWM or COWM is emergency only medical for some non-citizens, and COWM Plus is pregnancy level full benefits for pregnant non-citizens. So we just wanted to make sure those terms were out there. Now for today's topic, we're going to be talking about how to get ready for the end of the public health emergency. But first we're going to review what the current state is for medical eligibility during COVID. We're going to talk about the state PHE versus the federal PHE. We have a fact sheet to share with you. We'll talk about what members can do now and how you can help them as community partners. And we'll have Colin from Ombuds team talk to us about some redetermination scams that you may have already experienced. And then we'll have Tammy talk to you about outreach for redeterminations, really what's at stake, why we're trying to reach people, and some of the ways that we want to do that. But we also have questions for you about that outreach and an invitation to participate in creating that. So stay tuned for those pieces. And then I put a note at the bottom here called questions disclaimer. That's a reminder for me to tell all of you that you are welcome to type as many questions as you want into the questions box today, but we want to acknowledge up front that we probably won't be able to answer all of them. We will answer what we can, but there is still a lot that is still being determined. So we will take your questions. They will inform how we move forward. They'll inform the kinds of questions we're asking internally, and they might lead to an FAQ. But I just want to manage expectations that we're not going to be able to answer everything today. I'm fairly certain. Do any of our organizers want to chime in before we launch into content? I think we're good then. All right, so the first thing we wanted to review is OHP coverage during the federal COVID-19 public health emergency. The big one is that medical benefits will not end for most members, and I'm sure you've all been experiencing that. There are a few exceptions at the bottom, but for the most part, medical benefits are not going to end, and that is a provision during the federal COVID-19 public health emergency. All of these are, in fact. Another one is that coverage will not be delayed for proof of income. So we're not pending for proof of income. You'll also have probably noticed that Cowan Plus pregnancy benefits are not ending at the end of the pregnancy protected period. They're staying open. Renewals are still happening. So hopefully you're all aware of that. Members are still required to renew and keep their information updated. However, cases won't close due to non-response to renewals or other notices. We're not closing for non-response. And if they report a change or a change during that renewal that might otherwise put them, for example, over income, that's not leading to a case closure right now. And again, except for the exceptions at the bottom. Now, all of that are permissions during the federal public health emergency. And that's different than the state public health emergency. So the state of Oregon public health emergency ended on April 1st. But all those permissions are based on the federal PHE. And the federal PHE was extended to at least July 2022. We don't know if it will be extended past that, but the federal government has promised to notify Oregon at least 60 days before it ends. Therefore, 60 days before mid-July, we'll know if it's probably going to be extended or not, because they have committed to giving us that 60-day heads up. Once we get that 60-day heads up that the federal emergency period is ending, and actually once it ends, Oregon will have up to 14 months to determine if each member is still eligible for OHP. And the reason it's 14 months is that once the federal emergency period ends, we then have 2 months to get our redeterminations plan operational, and then we'll have 12 months after that to run all of our redeterminations and make sure everyone is still eligible. I want to pause to see if there are any comments from our organizers or any questions for clarity that I should answer.
Hey, Deanna, this is Tammy. I just want to emphasize that redeterminations are not going to happen all at once, and that they'll be phased over the 12-month period, and that people will receive notice. So I know that question has come up in other forums.
Thank you. It's important and very important notes. I appreciate that. All right, so the state is still working on what that full redetermination plan looks like, and what that, Tammy, how did you say it? A phased, or spread out over the 12 months, not all at once. However, we don't have those details yet. We will be sharing them with you as soon as we come up with them. You can watch group site, you can watch for CP updates, you can attend your collaboratives, but this webinar is to help CPs and members get prepared for that. And those details are going to come later. One resource we want to point you toward is a fact sheet. It's called Preparing for Changes to the OHP coverage after the COVID-19 emergency. So this is what we have right now. That is a publicly shareable document. We put a link here. It is 2 pages. I think it's 2. It could be 3. And at the end, it has a whole FAQ I think it's going to be something that you would probably like to bookmark so that when people ask, you can refer to this. This is going to be your best resource right now. Tammy or anybody else, would you like to chime in about any other resources?
Yeah, well, we are creating a website for clients, members, and for general public. It's very rudimentary right now, so but that will be built out as we get closer to the redetermination process.
Great, thank you. All right, so the first thing, or one thing that I wanted to really make clear is what is at stake. And a couple ways that this is going to work. So the first thing is that we are going to try to redetermine, it's like a renewal, right? So just like we have to renew members automatically if possible, we will try to redetermine members automatically if possible. And the automatic redetermination, it looks the same as an automatic renewal. If we run their case through our hub and information matches and we don't need any additional information, we can redetermine them / renew them, and they can end up with another year of benefits without us needing to ask that member for additional information. Now, the challenge is that if their case is not updated and what we have on their case doesn't match that hub information, then we may have to send them a letter asking for more information. Now, that's the point at which we're really worried that people might not respond and therefore their benefits will end. Because if they don't respond to that request for more information, their benefits may end, even if they would still be eligible. So that's the population that's most at stake that we're most worried about. Because members really risk losing coverage if we can't contact them. So if we don't have a valid address or if they don't open their mail, because if they don't respond to a request for more information, that's when their benefits are at risk of ending. So that's that spot that we're focusing on during redeterminations, how to contact people and make sure they're responding. But even before that, if their case information is updated, that increases the chance that we won't have to ask them for more information. So that leads us to what members and CPs can do now. But before I go on to that, I do want to pause and see if any of our organizers have anything else to add.
Hey, Deanna, this is Dina. We have a question in the questions box. What is the impact of the state PHE ending on April 1st, ending in April 1st on OHP program? Now, while the state public health emergency ending doesn't affect OHP, I thought it might be relevant, or do you have anything to say to that?
So about other programs. Thank you for asking that. Is there anybody like Christy Taylor, anybody else who can speak to that?
Yep, actually, I was just typing. Oregon's declaration of emergency ended in April, but it has no impact on Medicaid eligibility. Medicaid rules are based on federal rules, and the public health emergency that we adhere to is determined by Health and Human Services specifically.
Are we able to speak to any other programs?
I wouldn't be comfortable doing that. I'm not that versed.
Okay. Maybe somebody who is one of our organizers can scan the fact sheet again, because I would have to scan it to see if if any information about that is in there. But I think it might just be about OHP.
I do believe that SNAP has different rules and would definitely say go find answers on SNAP somewhere else, but that might be one of the programs that is affected by the statewide public health emergency ending.
Thank you. And this fact sheet is just about OHP coverage. So that's out of scope for today, but I think it's an important question, and we can try to find some resources for you and send them out in an update or a follow-up. So thank you. All right, so we want to talk about steps that CPs can take to help make this process as easy as possible for your clients and for your members. The first one is that you can make sure contact information is updated in the one system for all the folks that you're working with. And what this looks like for some of our community partner organizations is they have added some steps to their workflow. So if people call about absolutely anything and they're already a known client, they look them up in the one system and they make sure their contact information is updated. And that is even more important now than it has been in the past. So if you could consider doing that, that could really help. At the same time, making sure household and income information is updated in one. Because like I said on the previous slide, the more their information is updated, the more likely we can verify their information from our hub, and the less likely it is we will send them a request for more information and risk them closing from not responding. The other thing you can do is you can help members check for notices in one that might be asking for more information. So those notices, of course, will be sent to them at their mailing address on record, but they will also show up in that members message center in the one portal. So you can always be working with people to check there to see if we need anything. And of course, if members are able to access their own one account and log in on their own, taking the time to show them how to do that is really building in some self-sufficiency and allowing them to be able to make those updates and take those actions on their own. So if you can feel that out and see who that is relevant for, that could really be a benefit. For those of you who are working with folks who are not stably housed, that is an extra challenge. So one thing you can ask is if there's a stable address that they can use to receive mail. You can also remind them that if they do get mail requesting more information and they don't respond, their benefits may close. So maybe they should be checking, especially as the federal public health emergency ends, they could be checking wherever they get their mail more often, like if it's a PO box or if it's general delivery at the post office, etc. But really making sure they're set up to receive mail as well as possible. I know that is a challenge, but it's something that if you can have an eye for, maybe you can make a difference for some people. And then lastly, our last recommendation here, although you may think of more ideas, is that you can ask members to periodically check back with you to make sure to keep their information updated and to check for needed actions, especially if they hear that the COVID federal emergency period has ended. Let them know that you're a resource and you can help them get their notices and make those changes or supply more information. Do we have any questions or anything else to add?
Hey, Deanna, this is Dina. We have several questions in the chat that might be relevant. Give me a second here.
Yep, we'll see what we can do.
Okay, I think the next one is regarding letters and how long do members have to respond to letters? And I'm wondering if that was a follow-up from another question. Give me a moment.
Well, I think for me, the way that I read that is when somebody gets a redetermination letter saying we need more information from you, how long are they going to have to respond? I'm not sure we have that information yet. Does anybody know? Any of our organizers?
This is Tammy. I do not know the answer to that question. I think that that's something that we can get back to people on. It also could be something that the community and partner work group will put in place. So sorry, I don't think we have an answer today.
That's okay. Something I can say is that I was part of at least the beginning part of the redetermination discussions, and there is an agency-wide lens for how to make this as easy as possible for members. So there is a desire to make that response time as long as possible. I shouldn't say as long as possible, but like to not make it short, to make it more generous so that people have time, because we really do not want people to not respond and fall off of benefits. That is the big lens, is how to reduce non-response. So I do know that the agency has a big eye for making that as helpful as possible.
And this This is Tammy again. I also want to mention that, we had talked about the phased approach to redeterminations, and I do think that the idea is to try to keep those who are at most risk on coverage as long as possible throughout that redetermination period.
Yep. And in general, like I said, the entire lens is for member benefit and to reduce people losing coverage, especially when they're still eligible. So I think I can at least hopefully give people some confidence knowing that there is really great intention and that intention, that really positive intention when trying to make these decisions within the rules.
I do want to chime in really quick that one of our colleagues, John, who has been more involved in the redeterminations work, has put into the chat that we think it's going to be 90 days. It will be probably extended, that response time. And then I also wanted to add that every notice will clearly state on it when the deadline is, which is sort of a non-answer, but may help as we start to see these once redeterminations begin.
Thank you. All right, Dina, do we have other questions that we can try to answer?
Yeah, there are several. Will people have another chance to turn in pending documents in one that have, if the date has passed, once the PHE is over during the redetermination, or will those people's benefits just end?
I have a feeling that's a question we'll need to take back and bring an answer to later.
Okay. Is a general delivery address considered valid?
It is considered valid. However, oftentimes general delivery will only hold mail for a short period of time, maybe a few weeks. So the risk is that if the member is not picking up mail on a regular basis, that mail will be sent back to the sender and then they won't receive it. So valid, yes, and potentially risky.
Okay. If a person wants to update information, we will find out a 4111. I'm not sure what that is. Fill out a 4111.
It sounds like a form number. Do any of our organizers know that form?
It sounds like it's someone who is not in the one system and has other ways of helping folks, but I'm not sure those are community partner routes because I'm not familiar with that form.
Correct. The person asking does not have access to one.
Gotcha. Well, I think mostly we're talking about folks with access to one or who are using the Oregon.benefits email to submit changes on behalf of a member. And of course, members and CPs can also call if they need to.
And let's see. I mean, sorry, this may be a follow-up from another one. I'm trying to connect it. There's a lot of questions.
I could tell. Thank you for filtering them. I really appreciate it.
Is it a general delivery address considered valid? So this is the follow-up for it. I mean, obviously they will need to respond if there is an RFI, but I just want to know if the address will not be automatically rejected as a valid address.
Thank you. So Christy Taylor, are you able to speak to general delivery as a valid address and what happens when mail gets returned?
Sort of. We don't reject for invalid addresses. We do need people to get their mail. And I think what you might be asking is whether if they don't respond, they'll get closed. I mean, for whereabouts unknown, perhaps. That probably would not happen. It would be closed for not responding to an RFI. If they didn't get their mail and didn't respond timely. So no, to answer the question as stated, it's not going to be automatically rejected as a valid address.
Thank you. If there are any follow-up questions, that person can type into the questions box. Dina, anything else right now, or should I move on and give you time to filter some more?
There's one about verbal consent. I'm wondering, will our ability to do verbal CP consents also be ending with the end of PHE?
Ooh, that's a great question that we've been asking. I don't know if we have any updates. Does anyone from policy know if we have updates on that request?
That is something we are currently exploring, and I don't have a definitive answer yet.
Okay. Do you want to do some more, or
Sure.
should we stop?
The next section is really about Colin talking to us about some scams that we've been hearing about regarding redeterminations and scams in general. So if we have any more questions, Dina, before we move into scams, we can ask them, but we can also pause and come back to it to give you time to look through those.
There's one that's just kind of relevant, just so to continue on about homeless. Can homeless clients update their address through email?
Yes, any member can use the Oregon.benefits email address. That's a public-facing email address to report an address change if that's their best way to do it. They can also call, but email would be a way. Any additional information on that from our policy or ops folks? Okay,
I'm going to pause now, Deanna, and we can come back.
thank you. In that case, I'm going to turn it over to Colin to talk about scams.
Good morning, this is Colin. Thanks, everyone. So Deanna asked me to come in here because in the Ombuds program, we'd heard this from a few different places, mostly through the rocks, but of some people being called asking to pay money for assistance enrolling or renewing an OHP coverage. And of course, that's concerning to us because we know that the OHP assistance that we provide should be free. And that goes for both OHP or Marketplace. But it's very possible that members of the community don't necessarily know that, especially in this time of confusion with what types of renewals or redeterminations are happening. So please be aware of scams. If you hear your clients tell you about them, please make sure they know not to pay. And if they can, write down the number that they're being called from. Because on the next slide, we'll talk more about what to do when those happen. Actually, sorry, no, on the next slide, we'll ask, have you or your clients experienced enrollment or renewal scams in 2022? And there's a poll everywhere link up there, but Deanna, go ahead and explain that.
So yeah, poll everywhere. I think a lot of you may have used it. It is a way for us to get some answers and to questions and be able to gather them, and then actually we can run a report later and pull those answers. I'm wondering if, you know what? Sorry, I have the poll everywhere. I put it in the wrong place. Here we go. I was going to paste this right into the questions box so that people can have it. And I will do that right now. So what we'd like to know is, have you or your clients experienced any enrollment or renewal scams or redetermination scams in 2022? And I will paste that somehow into the questions box. Sorry guys, it's taking me a minute. And you can just click on this link and it will take you to, in theory, to pollev.com, and that question should pop up if all goes well. It looks like it is because we have 18 people who have already responded. We have some more questions for you through Poll EV. So I'd like everybody to take this moment to pull that up in a browser window, either on your phone or on your computer, and respond. And that will also set you up for our more in-depth questions in a few minutes. Okay, and we will be able to see your responses. So most people haven't, but 8 or 9% of folks have. Okay, we have 201 folks on this webinar. So you can do your math. 16, 18 people, something like that. You can continue to answer that as we move along. So Colin, I'll let you keep talking while people continue to pull that up and answer.
Thanks so much. So one of the best ways for us to report scams, especially if it is from a legitimate business, is through the Report Scams and Fraud link through the Oregon Department of Justice Office of the Attorney General, I believe. The link is here. I think it's not clickable as the PDF, but it will be shared out afterward. And this is a form. It's available in English. There is a Spanish paper copy that I can provide to send out to this group afterward. But it just asks some basic information, as much information as you have. And then they're the ones that actually have the resources to investigate any potential scams or fraudulent actors that are trying to make someone pay for something that should be free. The second bullet point is a scam alert. So that's also by the Department of Justice. And basically, once they've confirmed that something is a scam, they'll send out an alert to the mailing list to let people know what to look out for. And then finally, if there's a case where someone is being assisted by an insurance agent that gives bad advice or doesn't have the right information or asks for payment up front, it's also possible to file a complaint against them directly. And this is actually for agents licensed in any state, not just Oregon. And I've definitely had times where someone said, I was, searched Google for how to enroll in OHP, and I got connected with an agent in Florida, and they signed me up for a private insurance plan, even though I was OHP eligible. Because obviously a Florida insurance agent probably doesn't know much about Oregon Health Plan. So we were able to file a complaint through the Division of Financial Regulation, which does manage insurance agents and companies. And I think this is my last slide, Deanna.
It is, and let's just confirm that. We do have some information. Colin, you and I had talked about, would people be receiving legitimate calls asking for information? And the answer is yes. That may also happen, and it can be confusing. So to supplement what Colin was talking about, ODHS or its contractors may contact members to remind them about upcoming redeterminations or program eligibility. So when they do that, they must verify the individual's information and make sure they're talking to the right person. So they will be asking security questions with personal information, and we recognize that can feel uncomfortable or seem suspicious. So it can be difficult to tell the difference between a spam call and a real call. What we can say is that if members prefer, they can opt not to answer those questions, but call the One Customer Service directly to review their case and see if any information is needed. Or they can go online onto their One Applicant Portal account, or they can work with a community partner to see if any information is needed. So we want to let you know that real calls and spam calls can both be happening, and that can present some confusion. Does anybody want to say anything else about that? Or Colin, would you like to offer any thoughts?
I think that was a good summary. Thank you.
All right. Thank you very much. I do want to take a moment to mention that I have uploaded the slides for this presentation into the webinar control panel under handouts. So you all have them. I will also be sending them out in a follow-up email. So just in case anybody had that question. Dina, I'd like to turn it over to you to see if we have any questions.
Yeah, there are some questions about material. Are there materials to share with service providers? Oops, I lost my space. Forgive me, there's a lot of questions.
I can imagine. That's why we're doing this webinar, because people have been asking us so many questions and we don't have the answers to many of them, but we wanted to share the answers that we do have right now. So that's why we're doing this. That's also why it is not complete, right? We don't have a complete redeterminations plan, but we still wanted to be in conversation to share what we can and answer what we can.
Are there flyers so we can post being aware of these scams so we can make sure our clients are aware to help protect them?
Colin, do you know of anything? Sorry.
I'm going to pass that question to Tammy if she's still on the call.
I am on the call, and we have not developed flyers, but we certainly can.
Maybe we
This
can
is
get a
Colin, I
sense.
think.
Oh, go ahead.
I was going to say, I think that ODHS is creating some type of flyer for specifically to some of their non-Magi programs, but I need to follow back up on that. I've just heard that there's some level of work being done, but I think it's a different subset of members than the ones that would be impacted by this redeterminations process.
I'd like to know if you can all answer in the chat box, in the questions box, if we created some sort of flyer that said, beware of scams, and I really don't know what it would have on it. But Tammy said we can. So if so, would that be useful to you? So if so, say yes flyer, and maybe any information that you would want to see on it, so that we can take that back and see if there's enough interest and approximately what it looks like. So yes flyer if you're interested in the flyer, and any information about what it might contain, or any guidance on what you'd like to see in it. Tammy, would that be useful?
That would be extremely useful. Yes, thank you.
So we'll watch the questions box for any information we can take away. Excellent. All right. The next thing we're going to talk about, and I'm about to pass it over to Tammy here, is that we don't have a full communications plan yet, but we are looking for information to help develop that. So I'm going to pass it over to Tammy from communications to speak to you about it.
Yeah, so this is Tammy, the House Bill 4035, I want to just kind of give some context for this community and partner work group. House Bill 4035 requires Oregon Health Plan and ODHS and OHA to create two groups. One is a task force to develop a bridge plan that could cover people who make slightly too much to qualify for Oregon Health Plan, but not enough necessarily to go into marketplace plans with subsidies. So that is one work group that is currently working on what a bridge plan, a bridge health plan like that might look like. And then once they have a proposal, they need to present it to CMS for approval. That's one work group. The second work group that's required by House Bill 4035 is a community and partner work group. And this group will advise agency on the best way to sustain healthcare coverage for as many people as possible, focus on those disproportionately affected by lack of access to quality healthcare, and also advise on communications and outreach strategies. The group will meet, I think that for the first few months, they'll meet twice a month, and then the schedule will move to once a month. And they'll be meeting for about a year. And we're looking for at least 4 current Oregon Health Plan members to join, and 4 community partners to join, so that we have the benefit of hearing the voices of community as these plans are developed that have direct impact on community. So I will stop there in case there are any questions. Okay, if no questions, we can move to the next slide. And so as noted, our communications will be informed by the community and partner work group, but broadly, we're developing a campaign that will include and really rely on our partners, including providers, CCOs, CBOs, insurers, and brokers, to help people navigate this redetermination process. Our messaging broadly will be phased throughout the renewal period. And right now the focus is really on trying to get people to update their contact information so that we can reach them as this process unfolds. We'll be using, letters, social media. I think I mentioned the website. We're exploring texting and robocalls. I think there will be some direct outreach calls as well. We'll be launching a paid media campaign to include social media, broadcast, digital, and outdoor advertising to just try to raise awareness of the importance of responding and the opportunity that presents just with the addition of the bridge plan. I think that there's, if people, again, don't qualify for Oregon Health Plan, there could be a viable option to maintain health coverage. And then certainly we'll continue to be transparent on the progress of the redetermination process through various channels. So I'll pause again for any questions.
Hey, this is Sean Snyder with the ROC team. There are a few questions in regards to the, let's see, the bridge plan, but it looks like we don't have a whole lot of capacity to talk about it today, but I just wanted to see if you're able to look at some of the questions that are in the chat box in regards to that.
Yeah, I cannot see the chat box. It's probably me, but
sorry guys, I was on mute. Oops. I think I'll address that, which is that today is really about getting prepared for the public health emergency. Those details about the redetermination plan and what it's going to look like, and we are talking about something called a bridge plan for people who are just over OHP eligibility, but we don't have enough details to really share that plan today. So that's what I was referring to earlier, where we'll take your questions, but this is more about how to get prepared, and then the details of what redeterminations are going to look like and all the different pieces of that, that's going to have to be a different webinar and a different offering. So we wish we could give you more information, and we hesitated to even talk about anything if we couldn't give you the whole package, and we decided that for transparency we would, even though we couldn't answer everything or talk about everything yet. So I just want to acknowledge that that's challenging, I think, for all of us to be in that space, and yet we chose to do it. So thank you for understanding. Let's see. I'm trying to answer some questions on the background also because there are a lot of questions. So thank you for sending in those questions. I will reiterate that even though we can't answer all of them, we will be taking them forward to inform what we need to be talking about internally and what we need to be prepared to answer. Let's see. We saw lots of interest in a flyer and some great suggestions about what would be on there. So thank you very much. I will export that information and I will get it to Tammy in communications. And I also see some questions that it will address at the end that are more general about the one system and different ways to submit applications. And let's see, are there any questions, Dina, that you can see right now that we need to answer before we ask community partners a bit about their outreach thoughts?
I have some that have been flagged red by our CPOP team that we should probably address if we have time.
Yep.
Okay. One is, please advise the best way to assist a member when the one system is down, as it seems to have multiple IT issues. Sometimes I just have the member call in due to time's sake. Has the recent problem with validating credentials been resolved?
Yeah, that is something that's going on right now. It's a little bit out of scope, but that's okay. I think everybody's probably experiencing it. We have posted on group site that you can try to reset your email password. Reset your applicant portal password. That should resolve the issue, at least temporarily. And if it continues to happen, then you should call the community partner line, select the option for technical assistance, and log a ticket for it. They're trying to figure out why it's happening. We do know what's happening, and I haven't seen a resolution yet today, but I've been here on this webinar, so maybe I've missed something. Anything else that's, I'd like to save those for last, so.
Yeah, nothing now. Let's
yeah.
go ahead and we
Okay.
can with you. Thank you.
Great. Let's see, what do we have here? So we have some questions for you. I think that many of you already pulled up this this web page. So pollev.com/OliverVera795. I'm going to put that in the chat box again so that you can all grab it and go to that website so that you can answer this poll. We have 3 questions for you, and we would like as many people as possible to share the answers through Poll Everywhere, because then we can export them really easily and not have to go through our hundreds of questions in the chat box here. So I'm going to pull up the first one. And the first question is, what ideas do you have to get updated contact information for OHP members? This is very much to inform our outreach efforts, because remember that what is at stake slide? If we can't contact people, but they're still eligible, and they don't respond to a request for more information, their benefits may close, even if they're still eligible. That's our risk pool. So what ideas do you have to make sure we get updated contact information for OHP members? Tammy, is there anything else you wanted to say about that while people are thinking?
I don't think so. I look forward to seeing the responses.
Okay, let's see what those responses are, and that might generate other responses. So let me turn on responses here. Okay, outbound calls, call people and say, is your information correct? Have the community partners call their OHP clients. Excellent. Flyers, events, a hotline for maybe updating your contact information quickly without having to wait on hold on the phone. That's how I'm reading that. Direct outreach through calls and emails. Paid ads, social media. Text message campaign. I think maybe Tammy had talked about that. Okay. A text line they can respond to. I love that. Please respond with your, yeah, interesting. Okay. Tammy, anything else you want to prompt folks with to get more input?
I don't want to interrupt the flow. I think it's really, really valuable information.
Okay. All right. Thank you very much. Yeah, to service providers. That's interesting. Providers might have updated information, and I'm wondering if maybe there's some partnering potential there. All right. Thanks, everybody. I'm tempted to move on to the next one, but I'm stalling a little bit because I'm still seeing great ideas, like the value of social media, especially in the rural areas. All right. I'm going to move on, if that's okay. All right, so knowing that we have to do redeterminations, I'd like to move on to messaging, or rather Tammy would like me to move on to messaging. And the question is, what kinds of messages do you think are going to resonate or we need to highlight for the community during this redetermination process? So what could those messages be? You know, if we don't have your, well, I don't want to, sorry, I'm not going to prompt it. What are some top line short messages that you think we could highlight to make a difference for folks, to make sure they are not going to drop off, even if they're still eligible? And we will show the responses here. And again, if you need to get to the poll EV, you can, I posted in the chat box the website for that, the URL, so you can just click on that. If you can't get into the poll EV, you can always put your answer in the questions box, but we prefer it in poll everywhere if possible. So respond or you use your benefits. We want to serve you better. We need to confirm your information is correct. Your coverage is at risk. Don't lose your coverage. There's something different going on now than what was going on before. Don't lose your OHP coverage. Oh, a stamp on the envelope stating that something is needed. I like the response required. Give people a reason why we need more information. Be direct about it. Time to renew. If you didn't get a letter, please check with your community partner. That's great. If updated information is not received, your benefits will end. So something about losing your benefits, benefits at risk, losing access to health and coverage. Definitely give them various options for responding, as many as possible, I would say. Respond or risk losing your coverage. Okay. Tammy, is there anything you want to say here to prompt more answers?
Honestly, no. Again, this is just really, really helpful.
Okay. I think something that I'm seeing in here and reading in here is to make sure people have various ways to respond, and that we don't have barriers like a 20 or more minute wait time. So I'll call that out. Okay, I'm going to move on to the next question. And thank you for that. We will be doing this in other languages as well. Absolutely. Although this webinar is in English, we also repeat this webinar in Spanish in 2 weeks, but redeterminations is going to be an effort in many, many languages, far beyond English and Spanish. So thank you for calling that out. All right, here's the next thing. This is their third and last question. We have this redeterminations community and partner work group with 4 CPs and 4 members and others to help inform what all this looks like. We are looking for folks who represent a variety of communities. So if you would like an invitation to participate or you'd like to learn more about that, you are not committing to anything. But if you are redetermination work group curious, please put into this poll everywhere question your email as well as the communities you represent. And I think just in the interest of protecting people's emails, I'm not going to show this response. Okay, so I won't show this one publicly. But if you would like more information without committing to anything, please state your email and the communities you represent. I know that Tammy wants, and the agencies want to get a representation of different communities, different geographic areas. Tammy, what else would you like to say about this?
I think you're right. Yeah, definitely. We want a cross section of people from across the state to inform this process. You know, as we saw in the last 2 questions, there are lots of great ideas coming from lots of different perspectives, and I think we're going to be most successful if we can incorporate as many voices as possible. So yes, definitely would encourage people to engage if they can.
Great, thank you very much. So again, I'm not going to show the responses just to protect people's emails and their information. But I will leave that poll up. I think it should stay up right now because I'm not launching another one. But But now we want to take a moment to answer any of your questions that you've put into the chat box that we can answer, or acknowledge that we can't answer them yet, and it will inform our discussions going forward. So Dina, do you have any that have been flagged? And I'm looking at them too to help out. So, but I'd like to turn it over to you to see if there's anything we need to bring into the public space.
Hey, yeah, there's several. I was thinking to just go up from the last unanswered and
Sure.
go down if that's okay.
And I'd say at this point, it's all on the table. So however you want to manage it.
Perfect. Okay. If people have requested to be contacted by email or phone only, will they still get this letter by mail? So this is back at 9/16. So when you were first talking about.
Absolutely. When people we request contact by email or text, that just means they get a notification by email or text saying you have a message from OHB. They don't actually get the notification of the letter itself. So yes, they will always get the physical mail, and whatever physical mail our One System sends out will also show in the One System message center as well. So members can always come to their community partner to say, do I have any mail? Can you look it up for me? And you can do that by looking them up in the applicant portal. I hope that answered that.
Awesome. Thank you, Deanna. I have another one, which I feel like it was touched on, but it's asking what relevance is the state PHC ending on our various programs?
Today's scope is medical, and the folks on the phone are really equipped to talk about medical. And I don't believe we have anybody who's equipped to talk about SNAP or TANF or other programs. So I'd like to follow up by finding some information and sending what we can find, but we can't answer that today. I'm sorry. But it really could and may be different. So don't assume it's the same.
A majority of clients I work with have mental health, substance use disorders, or are homeless. These clients can be hard to reach, and they won't know sometimes about RFIs or won't check their general delivery. So that was more of a comment than a question.
Yep, that is a challenge, and you know your clients best, but that's in one of the slides we said if somebody is unstably housed, if you can start to talk to them about the importance of receiving mail, and if there is a place where maybe somebody can collect mail for them, or they can check back with you, so you can be checking their One Applicant Portal account to see if they have any mail. Those are some ways to handle it. But if you have other thoughts, folks, on ways to handle it, if you can please put it into the questions box and maybe we can share them, because you may really have other input there if you've been working with that.
Thank you. Next one is, can we get a little more information about what types of income are more likely to be updated automatically using the state's resources rather than requesting verification from clients?
Can you read that again?
Yeah. Can we get a little more info about what types of income are more likely to be updated automatically using the state's resources rather than requesting verification from clients? I'm assuming like interfaces within the systems is what they're referring to?
Yeah. Christy, do you want to speak to that, or would you like me to speak to that?
Well, and I just want to say generally, I mean, I think this is something we could probably provide additional information about as we continue to roll out and what to expect as far as income RFIs for verification. But generally speaking, the way the system works is that we ping off of federal databases. So number one, for earned income, we ping against earned income records, as well as some unearned income like Social Security. When we get into, so those things are more easily verified electronically without needing to pend, but it's when the information we receive from those data sources do not match what is currently on the case or what someone is attesting to us, that's when we need to reach out and say, hey, we need more information from you to verify what you're reporting because it doesn't match what we're able to verify for you electronically. So that's when it becomes more questionable. And I can tell you that self-employment is one of those places where we really don't have any electronic sources that verify self-employment income types. That's probably the biggest one that may generate verification requests. I will say too that we are trying to add as many flexibilities in the system to consider income verified as we can, so that we can minimize the number of RFIs that we have to send. And again, that gets into the weeds, and there's a lot of planning still going on about how that's going to be done, but we're going to try to verify as much as possible without having to pen people for verification.
Thank you.
Will people have another chance to turn in pending documents in one that have, if the date has passed, once the PHE is over during the redetermination, or will those people's benefits just end?
And I think I think what that may also be referring to, and maybe Christy can answer this, or maybe not, I don't know, is right now, or in the past with renewals, you would have a 90-day, I don't remember what it was called, a 90-day period to turn your benefits back on without having to submit a full new application if your benefits close due to not responding to a renewal notice. So will that be a thing with redeterminations? Do we know anything about that yet, Christy?
Yes, we do actually. And I see this is a repeated question throughout chat that I've answered a number of times, so I'm glad to speak to it. A redetermination is the same thing essentially as the process we go through for renewal, and our rules have not changed. So yes, if a person is pended at the time of their redetermination for more information, or to return, for instance, an active renewal where they have to sign it, and they don't respond to that request, their benefits would close at the due date, but or at the end of their certification period, but they will still be provided that 90-day reconsideration period to reply with the needed information late, and we can still process their redetermination after the fact within that 90 days without requiring a new full application. Now, I want to make very clear that's different than if they are redetermined and determined ineligible and get closed because they're no longer eligible. And then within that 90 days, they want to reapply. Of course, they could do that, but they would need a new application in that instance.
Thank you. I see a question here that I'd love to make sure we're flagging. Then there's a lot of questions here, but will redeterminations most likely be at the time of renewal? We now have access to renewal dates. Will we get access to redetermination dates? And will there be any alignment with expected renewal dates? Are we able to answer that?
I want to speak to that generally. That's one of the points I was hoping we could also make on this, because a lot of people have been really freaked out about what all this means and that people are automatically going to suddenly lose their coverage and all of this. Yes, because because all states are being provided with an entire year to redetermine people after the end of the public health emergency. That means that we will be able to normally redetermine them at their next renewal period. We're not going to do so before that time. So what this is going to look like for the majority of Oregonians is that we will simply renew them at their normal renewal time. And I'm very glad you asked that. And I think that's just going to be a normal process, other than some of the eligibility protections that we've been able to implement and adhere to during the public health emergency will be lifted, such as we will no longer be taking self-attestation for income. We'll have to verify it sometimes if we can't otherwise electronically verify it. So it might result in pens or whatever, but we kind of just revert to normal process. Now, the redeterminations that we're talking about become much more relevant for those who who have already reported being ineligible. For instance, they're over income, and we are now holding them open for the remainder of the public health emergency. Those are the ones that, or perhaps they didn't respond to their last renewal is probably a better example. And they were due to renew 5 months ago, and we are still holding them open. We have not completed a renewal for them, and they are overdue, but we are holding them open during the public health emergency. Those are the ones that don't really have necessarily an upcoming renewal period per se. Those are the ones that we will need to fit into a phased approach over the coming, the 12-month unwinding period. I hope that's clear. That's complicated, but the bottom line is, yes, most people will simply experience redetermination at their normal renewal time.
Thank you, Christy. Dina, did we have other questions? This is why we go until 10:15 on this webinar, by the way, is so that we can address as many questions as possible.
We have more questions. We may need to get back to some. I have one. Once completing a redetermination, I keep receiving the message pending agency review. I call in after the determination, and the OHA worker is baffled why the case did not go through either. But they seem to give it that additional push. Any way to get this back to being a streamless process. I miss the instant approval denial and don't have time to be on the phone for 1 hour a day.
Is there anybody from our organizers who knows what that's referring to and can address it?
Without specific examples, it's hard to say what's actually happening with certain cases. And I mean, we know that there are situations that kick out where workers are required to review and finish processing for various reasons. So it's hard to sort of address this in any general sense, I'm afraid.
Mm-hmm. The other thing that, I mean, to me, it sounds like a member match, right? Could be a member match issue, and I know we're working on reducing member matches, trying to figure out how to reduce those. I flagged a question here that I'd like to ask. Is there a way to run a list of clients who are connected to a community partner so that the community partner can reach out to them and help them, help usher them through that redetermination renewal process? Chrissy, do you have thoughts on that?
I have thoughts and questions. I think I recently learned that there was a way to run some reports in applicant portal about, and I'm not going to say that very well. I'm wondering if that's a possibility. I think that's a really good thought, and I think we want to explore whether that would be helpful for outreach, I guess, to see if this is a way that community partners can help us engage.
Yeah, and so there is that function, right, where you can click in the applicant portal, who are my clients coming up for renewal within the next 45 days? And I don't know how well that function is working right now, or if it is a function that should be used during this redetermination process to help. So that is one, that's the question, I think. And we may have to get back to people on that. And we are, I believe, from what I see from John, we are requesting from our agency a way to be able to let community partners know who is up for renewal, who of their clients is up for renewal. So that is definitely on the asking table and in active discussion. So I'll keep my hopes up for that one, but the answer is we are advocating for that. Thank you for being interested in it. All right, I think we have time for about one more question.
Deanna, do you want to pick the question, or?
I'm trying to. I see some advocacy for being able to continue verbal consent and remote assistance. We agree. We are just trying to get permissions for that. Let's see. Is there anything else that you're seeing, Dina? We may have done it and answered a lot of the questions that we can. We understand that there's some questions in here that we can't answer. I do see one here. Let me read this. Sorry. There will be a lot of folks trying to get on marketplace plans at open enrollment. Will they be prioritized to have an option to redetermine on their own before getting a letter? And I think in general, you know, as people are redetermined, they are found over eligible for OHP, over income, that will create a special enrollment for them for a marketplace plan. So I think hopefully that's a common understanding. And I'm not sure I understand the rest of the question. Do any of our organizers, that question came in at 10:07. I don't know if you can see it and speak to it.
Yeah, I'm not sure that there's a special process to notify people ahead of us notifying them. I'm not sure exactly what that means. We need to put them through a redetermination process to know if they will continue to be Medicaid eligible or whether they would need to be referred to the marketplace. And so there's no way for us to kind of do all of that ahead of time. So I think they're just going to go through the normal process. But as it was mentioned, I want to stress there, and it's true, we are extending like normal RFI periods from 30 days to 90 days to give a lot of extra time and opportunity for outreach when we do need more information back before we take negative action on a case, so that they have that transition time and heads up well ahead of time to the best of our ability. So I'm not sure I can give too much more detail about that because I'm not really sure, but hopefully that answers it.
Well, I think that's all we have time for anyway. So what I will let people know is that I want to say thank you to all of our organizers for being here to answer questions. Thank you for all of you for asking such amazing questions. And thanks for my team for helping to field the hundreds of questions we got. These slides are uploaded to this webinar and I will send them out afterward. We are also recording today's webinar and you will be able to grab it from GroupSite. You can register for future webinars or find all past webinars and recordings also on GroupSite, and we've provided those links. So I think to respect everybody's time, I will say thank you very much. This is a work in progress. We will continue to communicate with you as transparently and frequently as we can based on what we know. So have a wonderful Wednesday, and thanks for being here.